My name is Wendy Klegin, and I'm here to present my drug, metformin. I chose metformin to present to the class for my project for pharmacology because my husband actively takes metformin, and I wanted to learn more about the drug itself. Metformin is a classification of oral diabetes medication. It falls under the classification of bigonides. It has a brand name of glucophage, which I had heard of before, and a generic name of metformin, which I'm more familiar with. It's used primarily to treat type 2 diabetes. It works by affecting the production of glucose that comes from digestion, and it was first FDA approved in the US in 1994. Some interesting drug facts. One thing that I found interesting was that the drug was first synthesized in the early 1920s. So the drug has been around for a long time. French physician Jean Stern published the first clinical trials for the treatment of diabetes type 2 in 1957. It was first developed by Lipa Pharmaceuticals, and it was licensed to Bristol Myers Squibb. The patent expired in 2002, and now over 15 drug companies currently make the medication in the United States. I'm going to go over a little bit about what diabetes type 2 is, since this is primarily what the drug is used to treat. It was formerly known as non-insulin dependent diabetes, and it's when your body does not produce enough insulin or cells do not properly use the body's insulin. It's a chronic condition that causes your blood glucose to rise. It can cause hyperglycemia, and it's the most common form of the disease diagnosed because it's diagnosed later in life after puberty, and it's known as adult onset diabetes. The dosage and routes of administration for this medication are normally in tablet form. You have a 500, 850, or 1,000 milligram tablet. Your usual dosage will be taken by mouth, 500 milligrams twice daily, or 850 milligrams once daily. They do now have extended release tablets, which are used as a second option for someone who's maybe not having a good effect with the first tablet, because this would stay in the blood system longer. They also come in 500, 750, or 1,000 milligram. And something I didn't know was there is an actual solution, 500 milligram per 5 milliliter. It's made available to individuals who cannot take pill form. The dosage is adjusted dependent on the need. You'll go back to your doctor and work with him with your blood glucose levels to adjust the dosage as needed. Some of the benefits of metformin is it can help lower your bad cholesterol, which in turn will help prevent heart disease. It also helps prevent a lot of ailments that are known to be associated with diabetes. It can help prevent blindness, kidney disease, heart disease, nerve damage, and loss of limb. What it does is it increases the sensitivity of the liver, the muscle, fat, and tissue to uptake the effects of the insulin. A lot of times people find once they are diagnosed diabetic and given metformin that they tend to lose body fat. They'll tend to lose weight because it helps your body metabolize quicker. There are a few risks and side effects associated with the drug. They're not as severe as I thought maybe some of the side effects or the risk could be. There's a risk of nausea, vomiting, gas or bloating, diarrhea, or loss of appetite. But in rare cases, one of the fatal ailments or side effects could be lactic acidosis, and this is when your body, when there's a buildup of lactic acid in your blood level, and your oxygen levels drop, and this can be a deadly side effect to the disease, but it's very rare. Some warnings and contradictions of the disease are, it's it hasn't been studied in children, and so therefore they don't give it to children, pregnant women, or nursing mothers, because the medication can be crossed over in the mother's breast milk. It is taken after meals, so if you're taking twice daily, you're going to take it after breakfast and after dinner. And one of the things that it says you need to avoid when taking metformin is the drug Tagamet. Tagamet is known to decrease the elimination of metformin, and it can increase your blood amount by up to 40%, which could cause an overdosage of the medication. Some other useful tips for taking the drug are you should take it at the same time every day, and you should limit your alcohol consumption. Seek medical attention if your pulse rate slows, you have shallow breathing, the person turns cold or is turning blue, and those are all signs of the lactic acidosis that I talked about earlier. The half-life for metformin is 6.5 hours. And then I asked the question of why is metformin so widely prescribed, and the World Health Organization states that metformin is the most widely prescribed drug for type 2 diabetes. 48 million prescriptions are given in the U.S. These were census taken in 2010. Only 1 of 2 anti-diabetic medications are prescribed most widely in the U.S., metformin being one of them, and it's the only one clinically proven to prevent cardiovascular complications in diabetics. So some of the quiz questions that I'm asking pertaining to the slides are, what is the drug classification of metformin and what disease is it used to treat? What is the brand name of metformin? What is the half-life of metformin? And what are 2 reasons why metformin is so widely prescribed in the U.S.? And what are 3 side effects associated when taking the drug metformin? This is going to conclude my presentation on metformin. I hope that you've learned something from my presentation today, and I hope everyone has a good day. Thank you.